Wilson's disease is a rare inherited disorder that causes copper to accumulate in your liver, brain and other vital organs. Most people with Wilson's disease are diagnosed between the ages of 5 and 35, but it can affect more youthful and more seasoned people, as well. Copper plays a critical job in the development of healthy nerves, bones, collagen and the skin pigment melanin. Normally, copper is absorbed from your food, and abundance is excreted through a substance delivered in your liver, bile. But in people with Wilson's disease, copper isn't eliminated as expected and instead accumulates, potentially to a hazardous level. At the point when diagnosed early, Wilson's disease is treatable, and many people with the disorder carry on with normal lives. Wilson's disease care at Mayo Clinic. Symptoms: Wilson's disease is present at birth, but signs and symptoms don't appear until the copper develops in the brain, liver or other organ. Signs and symptoms vary depending on the parts of your body affected by the disease. They can include fatigue, lack of appetite or abdominal pain, a yellowing of the skin and the whites of the eye, jaundice, brilliant earthy colored eye discoloration, Kayser-Fleischer rings, liquid development in the legs or abdomen, issues with discourse, swallowing or physical coordination, uncontrolled movements or muscle stiffness. When to see a doctor: make an appointment with your doctor in the event that you have signs and symptoms that worry you, especially if a family part has Wilson's disease. Causes: Wilson's disease is inherited as an autosomal latent trait, which means that to develop the disease you must inherit one duplicate of the defective quality from each parent. In the event that you get only one abnormal quality, you won't turn out to be sick yourself, but you're a carrier and can pass the quality to your youngsters. Risk factors: you can be at increased risk of Wilson's disease if your parents or siblings have the condition. Ask your doctor whether you ought to go through genetic testing to find out in the event that you have Wilson's disease. Diagnosing the condition as early as conceivable dramatically increases the chances of fruitful treatment. Complications: untreated, Wilson's disease can be fatal. Genuine complications include scarring of the liver, cirrhosis. As liver cells try to make repairs to damage done by overabundance copper, scar tissue forms in the liver, making it more difficult for the liver to function. Liver failure. This can happen abruptly, acute liver failure, or it can develop gradually over years. A liver transplant might be a treatment option. Persistent neurological issues. Tremors, involuntary muscle movements, awkward gait and discourse difficulties usually improve with treatment for Wilson's disease. However, a few people have persistent neurological difficulty despite treatment. Kidney issues. Wilson's disease can damage the kidneys, leading to issues, for example, kidney stones and an abnormal number of amino acids excreted in the urine. Psychological issues. These might include personality changes, despondency, irritability, bipolar disorder or psychosis. Blood issues. These might include destruction of red platelets, hemolysis, leading to anemia and jaundice. Diagnosis: finding Wilson's disease can be challenging because its symptoms are often difficult to diagnose from other liver diseases, such as hepatitis. Also, symptoms may change over time. Gradual behavioral changes can be very difficult to reconcile with Wilson's. Physicians rely on a combination of symptoms and test results to make a diagnosis. The tests and procedures used to diagnose Wilson's disease include blood and urine tests. A blood test can check your liver function and also check the level of the protein that binds copper in the blood, ceruloplasmin, and the level of copper in your blood. Your doctor may also want to measure the amount of copper extracted from your urine within 24 hours. Eye examination. Using a microscope with a high-intensity light source, slit lamp, the ophthalmologist examines your eyes with Kayser-Fleischer rings, which are caused by excess copper in the eyes. Wilson's disease is also associated with a type of cataract, called the sunflower cataract, which is seen in eye tests. Removal of a liver tissue test, biopsy. Your doctor inserts a thin needle into your skin, into your liver, and pulls out a small sample of tissue. The laboratory tests the excess tissue. Genetic testing. Blood tests can identify the genetic mutations that cause Wilson's disease. Knowing the change in your family allows doctors to diagnose your siblings and begin treatment before symptoms appear. Treatment: your doctor may recommend a treatment called chelating agents, which binds the copper and makes your organs release copper from your blood. The copper is then filtered by your kidneys and excreted in your urine. Treatment then focuses on preventing copper from forming again. For severe liver damage, liver transplantation may be required. Medications: if you are taking Wilson's medication, the treatment is lifelong. Medications include penicillamine, cupramine, Depen. A deceptive agent, penicillamine can cause serious side effects, including skin and kidney problems, bone marrow failure, and deterioration of emotional symptoms. Penicillamine should be used with caution if you have an allergy to penicillin. It also keeps vitamin B6, pyridoxine, in working, so you will need to take supplements in small doses. Trientine, Cyprine. Trientine is very effective as penicillamine but usually causes a few side effects. However, neurological symptoms can be severe when taking trientine. Zinc acetate, Galzin. This drug prevents your body from absorbing copper from the food you eat. It is usually used as a nutritional treatment to prevent copper from forming and after treatment with penicillamine or trientine. Zinc acetate can be used as a basic treatment if you are unable to take penicillamine or trientine. Zinc acetate can cause stomach upset. Your doctor may also recommend other medications to relieve symptoms. Surgery: if your liver damage is severe, you may need a liver transplant. During liver transplantation, the surgeon removes your diseased liver and replaces it with a healthy liver from the donor. Most of the transplanted liver comes from deceased donors. But in some cases the courage may come from a living donor, such as a family member. In that case, the surgeon will remove your diseased liver and replace it with a donor's liver. Lifestyles and home: if you have Wilson's disease, your doctor may recommend that you limit the amount of copper you use in your diet. You may also want your copper tap water levels checked if you have copper pipes in your home. Also be sure to avoid multivitamins containing copper. Foods that contain high amounts of copper include courage, mussels, mushrooms, peanuts, chocolate. Preparing for your appointment: you will probably see your family doctor or general practitioner first. You may then be referred to a liver specialist, hepatologist. What you can do when making an appointment: ask if you need to do something in advance, such as cutting your blood pressure for a blood test. Make a list of your symptoms and when they started. Key personal details, including major stressors, other medical conditions you have, and family history of Wilson's disease. All the medicines, vitamins or other ingredients you take, including doses. Questions you should ask your doctor: take a family member or friend, if possible, to help you remember the information you are given. For Wilson's disease, the questions you should ask your doctor include: what tests do I need? What treatment do you recommend? What are the side effects of the recommended treatment? Are there alternative therapies? I have some of these health conditions. How can I treat them better together? Are there limits I need to follow? Should I see a qualified physician? Should my family be tested for Wilson's disease? Are there any brochures or other printed material that I may have? Which websites do you recommend? Do not hesitate to ask more questions. What to expect from your doctor: your doctor may ask you a number of questions, such as: have your symptoms been persistent or occasional? How bad are your symptoms? What, if anything, seems to improve your symptoms? What, if anything, seems to make your symptoms worse?